Here are some of the latest headlines of the COVID-19 outbreak. We expected new jobless numbers released this morning to be bad, and they're bad. Roughly 1 in 10 workers in the United States has lost their jobs in the last 3 weeks. An additional 6.6 million people applied for jobless benefits just last week. Minnesotans are going to have to stay at home for at least a couple more weeks as well. Tomorrow was supposed to be the final day of the governor's stay-at-home order, but yesterday, no surprise, as Governor Tim Walz made the decision to extend it through May 4th. Governor made it clear that he feels stay-at-home is working. Early on, we were doubling our cases every 2.5 days. Now it takes 8 days.
Do not get complacent. Do not give up all the hard-earned gains that you made.
Minnesotans are overachieving, the governor says, especially compared to other states around the country. He would like to keep it that way. Some debate over the models here, trying to see exactly what's going to happen going forward. Some models show our spike could be 1 to 3 months away. Keeping strict social distancing rules intended to prevent COVID-19 from spreading too quickly. It also buys hospitals time. Right now, Minnesota has 1,000 ICU beds. The state is estimating they'll need to triple that by the time they hit the peak. People who had something to say about it on social media were split between frustration and understanding. The state will work with some of the non-essential businesses to possibly reopen with strict social distancing guidelines. Golf courses can mow now. Lawn care companies also can get back to work.
Minnesota Department of Health announced 5 more COVID deaths. 4 people lived in long-term care facilities, and the other person did have an underlying health condition. The state has seen 39 deaths so far and more than 1,100 known cases. There are more than 2,700 confirmed cases in Wisconsin, and 99 people there have died. Most of Minnesota's cases are around the metro, but about 2/3 of the state's county have at least one confirmed case. The health department says that people living in rural areas are actually at high risk of getting sick. The department says that there is some evidence they're seeing that rural families aren't putting as much effort into that social distancing. On average, those communities do tend to be older, and there are fewer hospital beds to accommodate sick people.
Minnesota's only hospital dedicated solely to COVID-19 says more patients are coming through the doors. Bethesda Hospital in St. Paul has been retrofitted just to take COVID-19 patients. They've been taking those patients for 12 days. In that time, they tell us they've increased the number of beds from 50 to 90. Hospital plans on opening a second ICU by the end of the week so it can bring in patients from other hospitals. Bethesda saying they are not at capacity yet. City of Minneapolis stands to lose between $100 and $200 million from the COVID-19 crisis. Minneapolis Mayor Jacob Frey Skyped with us on our morning show today and said there is no organization across the state that hasn't been impacted by the outbreak.
We know that we have fees that are dropping dramatically. We know that we're trying to be lenient with some of the licensing requirements and some of the loans that we have out right now. And because of that, yes, the city's going to bring in less revenue. But, you know, this is not the time to do an around the back pass. This is the time to get the fundamentals down because our city deserves core services. Our city deserves to, you know, we're the government that doesn't shut down, and we're not going to.
Mayor says it's impossible to know the full impact the outbreak is going to have, but they want to take action now to curb the impact of what the city would feel later on.